Good day, I'm Ruyeras, and I'm gonna do diabetic foot care. So first thing to do is to determine the client's foot condition based on the assessment we gathered. So after determining, check for doctor's order. So I already checked the doctor's order. Then and tell the patient about the procedure. Ma'am, diabetic foot care, okay lang mo. So after asking permission for diabetic foot care, what I'm gonna do is to wash my hands. And I already prepared the equipment. And lastly would be to help the patient in a sitting position. So our patient is already ambulatory and she's already sitting. So I'm gonna do the assessment. So I'm gonna check first the feet of the patient, and I'll check if there are any inflammation, abrasions, laceration. So after checking, I'm also gonna check sa toenails kung kailangan ba ikat, and palpate if there are presence of edema. Mama, tuloy check ang fit mo, ha? So I'm gonna start the assessment. So check for any abrasion, inflammation. We have to check if there is any laceration. Ma'am, ako may check mong tilo na. So after checking his per feet, so I'm gonna put water on the basin. We have to not 40 degrees na water. So ito iput sapat para dili siya ma-spill. Next is I already assessed the patient sa sitting position, so I'm gonna put some pillow on his under the knees. Ang ating tangan. Ito pa naman. So after putting some pillow on the under the knee, so next is to after putting some pillow under his knees, I already prepared nga ang water nga nasa pot. Then I'm gonna soak the feet for 10 minutes. One feet at a time. So after putting the feet on the water, you have to put it for 10 minutes. Then after 10 minutes, we're gonna put some soap and then we're gonna wash it. So after washing it with soap, you have to pat it dry with a cloth, and make sure nga that to check sa iyang toes kay mo na ang pinaka-importante nga part. Inani mga pressure ulcers, mga laceration. So after washing it with soap, and roll it in, pat it dry. So after putting it dry, we have to change the water and And after changing the water, and ang opposite na sad sa feet na atong i-rinse sa water for 10 minutes. Ato nag-soak ang the other feet for 10 minutes. So while nag-soak ang sa kapit, okay, we have to cut the nails if needed lang. We have to put, but first we have to put lotion to avoid cracking and irritation. Matong lotion. So after putting lotion, we have to check if kinanglan ba na to i-cut ang nails. So kinanglan man i-cut ang nails, so mukat ta from the toes sa kanang bigger toes, then going to the second, third, fourth, fifth. So when you cut the ang nails ay sa upper part. So after cutting, make sure na round yan. Then we have to nail file it. So kung need good og if need good og kanang expert, we need to contact lang with podiatrist or further if needed good og kanang ikatang atong nails properly. So after finishing it, so manasad ang pika sa 10 minutes, so alternate, then ang pika sa sad atong i-clean. We have to pat it dry. Manasad ang soap there sa pikas, so then put sitag lotion to prevent cracking. Then after that, okay, if needed a cut of nail cutter ang nails, so we have to cut it from large to then to smaller. Then we're gonna use nail file para malay. And we already put it dry, so after cutting the nails round and then filing it, do it also sa pikas nga fit, then do the documentation if there are any problems sa yung feet, then do aftercare. Thank you.